Some of you will recognize this as one of the most painful conditions you can ever experience in the vulva. Bartholin's cyst abscesses can feel unbearable, but healing is possible with the right approach. In this video, I will explain what to expect as your cyst or abscess heals and when it's time to seek medical attention. Bartholin's gland swelling and infections can be frustrating, but with the right care, you should be able to get back to normal fairly quickly. Today we'll discuss how long it takes to heal from a Bartholin's gland problem and how to manage it effectively. Around 2 in every 100 women develop Bartholin's abscesses, so it's a lot more common than you actually think. Let's talk about the stages of healing, share tips for easing discomfort and pain, and answer some common questions just to help you feel more confident as you recover. Bartholin's cysts develop when the glands, which are located near the vaginal opening, become blocked, causing fluids to build up. These glands usually produce fluid that helps to lubricate the vagina. Sometimes it will cause a small, painless swelling near the entrance of the vagina. You may not even be aware that it's present. These tiny swellings, which incidentally are cysts, may usually settle by themselves within a few days and not cause any problems. However, there's usually a but, isn't there? If the fluid inside the cyst becomes infected, you may develop pus inside that closed space, which is then surrounded by swollen, inflamed tissue. That is an abscess. Now, developing a Bartholin cyst or abscess is sadly a very common type of vulval or vaginal lump. Check out my videos here or here to learn more about different types of vaginal lumps. The treatment of a Bartholin cyst often depends on its size, if it's infected, and other symptoms it's causing, including pain, fever, discomfort when walking, sitting, or other signs of illness. For example, if you notice a small, pea-sized lump that feels a little uncomfortable, soaking the area by sitting in a bath of warm water or sitz bath for 2 or 3 days at home may be all that you need to completely heal the problem. But if you're dealing with a very painful lump that's quickly getting bigger, then you need to seek medical attention fast. If you do that at very early stages, your doctor will provide a course of antibiotics which can adequately manage the infection in many cases. At that time, you may not really feel very sick with the fever or other signs of infection. Routinely, these antibiotics are given for 1 or 2 weeks depending on how your body responds, and that should clear up the infection. But the infection may have developed into an extremely painful abscess, and the swelling needs to be drained surgically in addition to antibiotics. Being quite unwell with a very high temperature, so above 40 degrees Celsius or 104 Fahrenheit, having bad headaches, vomiting, and other signs of severe illness are also reasons that indicate that you need to be admitted to hospital for a while. So let's look at some key points in what to expect when healing from a Bartholin's abscess. What is the normal healing timeline after surgical drainage? With proper drainage, it is roughly 2 to 4 weeks. Now, there are different ways of draining the abscess, but most commonly a balloon catheter procedure is used to drain away the abscess and create a permanent channel, making it difficult for any fluid to collect within that space again in future. This procedure is performed under local anesthesia and usually takes under 30 minutes to complete. You'll be allowed home after a short recovery period on the day ward. So next, what can you expect after the procedure? Now, although it sounds like a short procedure, we'd recommend that you take the following day off to rest. You should really be fit to resume normal activities by the day after that. You might experience slight bleeding around the vulva or vagina, or discharge from the area where they have left the balloon catheter for a few days. This is light and so should be handled by wearing a panty liner, which you should change frequently. You will be advised to avoid sex till after the catheter is removed because it could be painful, or you could risk an injury when the catheter is roughly pulled out, or if it's removed earlier than it should be taken out. What are the signs that your Bartholin's abscess is healing? As your body heals, there should be less pain, swelling, redness around your genital area. If that's not the case, so if you have pain that's getting worse or not going away, a fever or other signs of infection, please see your doctor as soon as possible. On the screen, I'm showing a list of helpful things you can do in the first few days after your procedure to keep your genital area and the catheter clean. Sitting in a bath of warm water, regularly having a bath or shower or using a bidet, using a hairdryer set to the cool setting for drying instead of a towel. If you use a towel, just gently pat your genital area, don't rub, so you don't risk the catheter pulling out. Okay, so now you've healed and things are back to normal. How can you prevent a Bartholin cyst or abscess from happening again? Well, to avoid repeat infections, it's important to practice good hygiene, wash and wear fresh underwear, change them regularly. Most women who get repeat infected Bartholin cysts are already doing that. So if despite your efforts you keep getting infected cysts, there is another surgical option which is known as a marsupialization that can be considered. This involves sewing the edges of the skin around a cyst after it's been drained to create something like a small kangaroo pouch, which is where the term marsupialization comes from, because kangaroos belong to the group known as marsupials, and prevent fluid from collecting there in future. So there you have it, what to expect when healing from a Bartholin's cyst or abscess. Please share your experience in the comments section below, because I know this is really common, and let me know if you'd like to learn more about conditions like this or others. Check out this other video where I also discuss Bartholin cysts, and I'll see you again soon.